There is no secret. Every day I wake up and I thank God for the ability to serve my purpose and to serve what He's put me here on this earth for. However, it is something that's difficult to balance. I'm not going to sit here and say I had the answer to balancing the lifestyle of being a physician, a mom. It's not easy, but it's definitely something that my mission is what drives me.
In today's episode of PSA, we welcome Dr. Sharica Brookins, a graduate of Meharry School of Medicine, class of 2012. After graduating, Dr. Brookins found her passion in nephrology and turned that passion into a groundbreaking career. Dr. Brookins is the founder of Remote Renal Care, the first telehealth kidney practice in Georgia. My name is Dr. James E.K. Hildreth, and you're listening to Public Service Announcement, the podcast dedicated to making complicated healthcare topics easily digestible for all who listen. This season, Season 2, highlights the enduring legacy of Meharry and the remarkable Meharrians carrying that legacy forward as we celebrate our 150th anniversary. To learn more about this show, or to learn more about Meharry Medical College, please visit meharry.edu. So Dr. Brookins, welcome to the show. And to get us started, can you tell us a bit about yourself and your journey in medicine?
Well, thank you, Dr. Hildreth, for having me on this season. So I am a first-generation college student as well as physician. So upon graduating, I attended Florida State University in Tallahassee, Florida. And I knew I've always had an interest in fitness and nutrition. And there we had a College of Human Sciences. And the dean of the College of Human Sciences, Dr. Penny Ralston, she had a mentoring program for minorities who were interested in health sciences. And she had a background in gerontology. So I looked up to her. She quickly became my mentor. And I had to do a project in which I had to create an assignment for myself, and that was to learn more about a profession. So as I learned more about gerontology, I discovered geriatrics. And I quickly fell in love with geriatrics. And so as I graduated Florida State, I just knew I wanted to become a geriatrician. Within my last year at Florida State, I began volunteering with Donate Life Florida. They came to our college campus to recruit volunteers that were college students. And after I graduated, I continued to volunteer with them back home in Jacksonville, Florida. And I met another volunteer who was another young Black female like myself. But I quickly learned that our stories were different and that I was volunteering to learn more about organ transplantation, but she was volunteering because she actually had failing kidneys. And so that kind of piqued my interest into nephrology. So once I got to Meharry, I knew that I wanted to become either a geriatrician or a nephrologist. So that kind of my journey to becoming my interest in becoming a physician.
Well, one of the things that's really notable about your work is that you focused on disparities in kidney disease. And so how did your time at Meharry concretize it for you, make it certain for you?
Yeah. So first getting to Meharry, I immediately discovered Dr. Faulkner. And it was Dr. Faulkner. I approached her during the month of June when I first got there. And she immediately, her advice to me was just focus on anatomy. And then you can circle back to me and we can talk more about nephrology. So after finished anatomy and physiology, and she kind of opened my eyes to more of the field of nephrology. But it was also there, knowing the mission of Meharry, is that not only as students and alumni, not only do we serve in the classroom, we serve in the clinics, and we serve in the hospitals, but there was also a mission driven into us that we serve in our community. So while as a student at Meharry, I immediately became involved in community service activities. I was a president of the geriatrics group. I discovered TKF, and I volunteered doing community spreadies with TKF. So that kind of instilled in me that once I become a private practice or a practicing physician, that being able to serve my community is just as important as what I do in the clinic and the hospital. So Meharry served a major role in realizing the impact that we serve as physicians in our community.
So you are or were the first Black nephrologist practicing in Augusta and the Waynesboro area of Georgia. What lessons or what experiences at Meharry do you think helped prepare you for that, being the first?
Yeah. So as I mentioned, I went to Florida State University, which is a predominantly white institution. And I also did my fellowship training and my residency training at a predominantly white institutions. But Meharry was just something different about the HBCU experience that instilled a sense of pride in me for not only serving as a minority in my community, but also the role of diversity. So once I graduated fellowship, I looked at practices in Tennessee as well as Georgia. I narrowed it down to 2 practices in Georgia. One was in Atlanta with a practicing group that existed of 6 or 7 Black nephrologists. And then there was Augusta, Georgia, where not only would I be the only female nephrologist in the group, but the first Black nephrologist in the town. And amongst praying, it was a no-brainer decision that, this is a community that could likely benefit from my attributes and the diversity and just the sense of pride that Meharry instilled in me. So I selected Augusta to be the place that I started practicing.
Wonderful. And one of the things that you've done, which I think is just a first as well, is you founded Remote Renal Care, which is a remote telehealth kidney or nephrology practice. How did you come to do that? What motivated you to create that organization?
Okay, so the group that I worked with, I only worked there for a year. And while I worked there, I also served as medical director in Waynesboro, which is a rural part or rural town right outside of Augusta, Georgia. So not only did I have was I the practicing nephrologist, the only practicing nephrologist in Waynesboro, also practiced in Augusta, Georgia. And then I was the medical director of a dialysis center there. So I had to go out on an emergency maternity leave. So I had to deliver my first child early. She was born 12 weeks early. And so that immediate decision for the sake of my firstborn child, it also left my patients without appointments. And so their options were, well, you can either go into the nearest town to Augusta to see one of the partners, or the option was for the partners to come to the clinic in Waynesboro to see my patients. And unfortunately, when I returned, what I discovered was a lot of my patients went without care because either they didn't have the transportation to get to Augusta, and also none of my colleagues wanted to travel to Waynesboro to continue the continuity of care of these patients. So after leaving this practice, I prayed on it and I prayed on it, and telehealth came to mind. And what I realized was it not only allowed me to serve in this new mission to provide subspecialty care to these rural areas that do not have nephrologists, but that I was able to do it in all rural parts of Georgia. 75% of Georgia is rural. So to me, it was an amazing opportunity. This was pre-COVID. So at the time, telehealth was really only permitted for those in rural areas. So I was the first practice that was 100%. I am the first practice that's 100% telehealth for kidney care.
Wow. So it may not be obvious to listeners how you could provide nephrology care over remotely like this. Can you just tell us about what a typical visit would be?
Yeah. So it's very similar to you and I, what we're doing right now. So let's say if you are an established patient, if you're in a rural town, you would either get your blood work performed at your primary care blood and urine test performed at your primary care's office, or you would go to the nearby rural hospital, which for most people may be 5 to 10 minutes away from where they live. And the same with imaging. So if there were any imaging that were needed, CAT scan or ultrasound or MRI for your kidneys, we were able to either order it through your local rural hospital. And now that we've expanded to urban areas, we do the same. You can either go to a local LabCorp or Quest, and then you can go to a local imaging center. And then at the time of your appointment, We just log in remotely, how we're doing now. We do encourage our patients to have a scale and a blood pressure cuff at home so that we not only encourage them to monitor their weight at home, taking ownership of their health, right, as well as monitoring their blood pressures at home. And then we just go over their labs because with kidney care, the most important thing is what your lab and your urine studies tell me, which kind of dictate our change in plan. And by going over that, as I mentioned earlier, I have a strong interest in nutrition, so I'm able to provide that during our sessions as well. And then we just schedule our follow-up appointments.
So I would imagine that the telehealth practice might reduce travel challenges and wait times for your patients. So is that true? I mean, can you tell us the impact on travel and wait times?
Yes, sir. One of the things that I am proud to say is our no-show rate is very little in telehealth because most people, when it's the time of their appointment, it's convenient. So it's not a matter of, they couldn't make it in time because of traffic or if something else came up. So we have a very minimal no-show rate. We also have a low wait time. So we don't have where you have to wait 6 months on a subspecialty visit for nephrology. And one of the things that I noticed when I was doing the in-person private practice, the first thing that most of these patients thought were that they had to start dialysis because all they knew was my primary care referred me to a nephrologist. Are you about to tell me I need to start dialysis? And so imagine having to wait 6 months for someone to tell you whether or not you were starting dialysis or not. So by shortening that time, and also what most patients have expressed to me is that it lessens the anxiety of what their kidneys are actually doing, whether or not they need dialysis. So I think in addition to the travel, but the anxiety, and also it allows them to get more immediate and effective care. So we're able to start treatment, sooner than waiting 6 months.
So I note in the work you're doing, you've also expanded into urban areas and there's a partnership with the VA. So can you share what impact that's had? What have been the outcomes of those partnerships?
So right before COVID, I was working at the VA. And what I noticed was at our facility in particular, we not only received patients from neighboring towns that did not have a VA, but we also did not have a lot of nephrologists. So that's also one of the downsides to our specialty is that we don't have enough medical students and residents entering into the field. So the VA has this program called community care. So that's one of the things that Remote Renal Care, that's what we offer veterans throughout the state of Georgia. If you are, let's say, you don't have a VA in your town, you can request what's called community care. And so that's what we offer. So we have veterans here in town. Either if your wait time is beyond 28 days, then you automatically qualify for community care because the VA knows the importance of getting these veterans scheduled as soon as possible. So that's how we work with the VA throughout this region. We're community care partners.
It's interesting you mentioned the challenge in getting medical students interested in nephrology. We partner with Tennessee Donor Services for the last couple of years to have Meharry Medical College medical students get to hang out with transplant surgeons and nephrologists, hoping that some of them will become very excited about it. And in fact, I think one of the students has in fact chosen to pursue transplant surgery as their career. So I think the exposure is very important. And I know that that's something you did. You volunteered with Donate Life there in Florida. So that's very interesting.
Yes, I remember the announcement, and I was very proud to see that announcement when it came through my email and the partnership that Meharry has. So I thank you for that, and I know it will make a difference.
Wonderful. So the other thing that I see here is that you plan to partner with, or maybe you're already doing it, partnering with mobile clinics to reach rural areas in Georgia. So can you tell us about that?
So mobile clinics, we know came on the rise after COVID, and it was a way to actually, you can have rural patients come to the primary care office, which was the most common way of providing telehealth. It was not like they could stay at home pre-COVID. They actually had to come to the primary care office, and then there's a designated room in which they would go in and do their televisits. So whether it was like one facility, they also offered telederm, you have teleneurology. So these were some subspecialties that were offered quite often. But after COVID, there were more mobile clinics that were present because they saw the impact of actually getting the care to the community. So instead of them coming to the primary care offices. And so you have some mobile clinics that are equipped with telecommunications and cameras. And what they do is they offer like telecardiology, they offer telenephrology. So there are certain days when they will go to said communities and allow these subspecialty visits to take place within the mobile unit.
Excellent. Well, one of the challenges with telemedicine or telehealth has been the limited broadband in some areas of the country. So has that been a problem for you to do the work that you're doing there in Georgia?
Can I say before COVID? You may hear me say that a lot, but COVID was like the pivotal point, even in which within our practice, we said we're going to expand to urban areas. Prior to COVID, it was definitely an issue. Although most people had mobile phones, but even just the cell towers were not in abundance, as and they're still not in a high abundance, but there's been, such an onset of contracts, right, for broadband companies to provide access to rural areas. So there's been a lot more expansion of contracts and funding that's been provided to expand broadband to these rural areas. So it's been less of an issue after COVID than before COVID.
Okay. And are there like policy changes at the state or federal level you think that might be needed to make sure that telehealth can be all that it needs to be for the people who need it or want it?
Well, we know as of October 1, with the government shutdown, obviously there needs to be a renewal because with telehealth implementation, it was not a permanent. It was not a permanent policy. It needed to be renewed continuously. And we're currently in that state to where right now, I'm not even sure if I will be reimbursed for patients who have Medicare that receive telehealth services. But I know that their care is far more important than that. But right now, we definitely need something that is more permanent in regards to providing telehealth services.
Okay. Well, one of the challenges in medicine, of course, as you know, is the continuity of care. And sometimes when people are going to brick and mortar clinics, they can fall out of contact with their providers or other things can happen. So does virtual care change that for you, do you think?
I will say we still have patients that we lose to care, but I think that just similar to the no-show rate being so low, we tend to have where if someone cannot make an appointment, they do contact us in a timely manner to reschedule. I know that when it comes to lupus patients and, especially younger African-American women living in rural areas, they tend to not have the best follow-up care with their rheumatologist, but telehealth has been something that's been, put out there to kind of help these patients be a little bit more adherent and available to continue with the continuity of care. So we do, tend to have some patients where we'll notice we haven't seen them in a while, but, we'll follow that up just like a brick and mortar center with contacting them. But I don't think it's as much as I've seen when I work in an in-person setting only.
Okay. Well, another thing that I think you're doing that's really important is the lunch and learn sessions that you do in the communities. So what lessons or what takeaways do you have from engaging communities in that way?
I love doing community work. Actually, I have days where I designate just for community work. So when I first moved here in Augusta, one of the ways of introducing myself to the community and getting to know the community was I started with these lunch and learn sessions with churches. And that was one of the things that, I was advised is to make sure you are, if you're going to educate, definitely hit up the churches. And I continue to do that. I'm doing community centers. I recently did one last week where I did seniors in telehealth. So I've done a variety of topics from transplantation, lupus nephritis, women's health. So it allows me, these sessions allows me to get to the community. And the most important thing I like to do is answer the questions that they don't know that are questions. So I've realized that some people don't know what questions to ask when they're in their doctor's visit. So equipping them with, well, these are some of the questions that maybe you could think about, and then I'll answer them for you, but also address them with your provider as well. So that's one of the things that I've received the most input from a lot of the community participants is either they didn't know something or they didn't understand something. And so being able to, see a familiar face, have that representation, feel like you can open up and get a realistic answer from me is something that I've definitely taken away from these lunch and learn experiences.
That's wonderful. And I know the other thing that's important to you is the notion of food as medicine. And that's something you've been focused on for a while. So how does that change your approach to what you're trying to achieve in kidney health? Or can you just tell us about how you integrate that into your work?
I light up when I talk about food as medicine because with kidney disease, the top two common causes are diabetes and hypertension. And we know that both of these chronic illnesses have a strong nutrition and diet component. And it's just a matter of educating the community about, I don't really like to say do's and don'ts. It's more of moderation and modification, right? It's not to say that you can't have your Southern cuisine. It's just, well, maybe let's substitute this, or maybe this is the frequency or the amount in which we could have it. So my interest in food and medicine actually led our practice to serve as major sponsor. And I'm also a current board member of an organization here called Augusta Locally Grown, which provides farmers market to a food desert here. And we actually have a food as medicine program. So we have over 30 participants in this program. They report at the end coming off of certain blood pressure meds, weight loss, diabetes improvement, and what they're learning. They're coming to their sessions to get their body measurements and their weight, but they're also having cooking classes. And then at the end of each week, they receive tokens to actually take to the farmer's market and buy this fresh produce. So I am a firm believer in food as medicine, especially when it comes to chronic illnesses like diabetes and high blood pressure and obesity, which is also a chronic condition.
I know there are a number of places in the country where the kinds of efforts you're describing are being done at a small scale. What do you think it's going to take to really scale that up to have a even broader impact?
One of the things that I think is important from a medical standpoint is, and I've seen it kind of pass through the news here and there, is educating our students a little bit more on nutrition. I know we do take nutrition at Meharry, but also, me having a minor in nutrition from Florida State, but definitely exposing our students to this. And I think that will help us to implement it more within our practice, our primary care practice. And not to say you're serving as a nutritionist, but you can have more of those talks because as physicians, our patients do hold us to a certain degree when it comes to our advice. And imagine if you're sitting in an appointment and your physician can give you a little bit more insight on what you're eating, makes you a little bit more compelled, just as much as we may tell you to take this pill. Now, instead, we're saying maybe try this sort of a diet. But I think in regards to on a larger scale, community-wide, for us, it's definitely, grant funding and private support. So whether it be a nationwide effort or statewide effort, definitely the funding has been a huge component that's helped us to get our program to where it is here in Augusta, Georgia. And we're able to serve actually more than one county. We actually serve 3 counties.
Well, I'm pleased to see that more of the major payers, Blue Cross Blue Shield, United Healthcare, and others are starting to fund programs like this because it would mean that people will be healthier and need fewer services from physicians, I guess. Anyway, I think that's a trend that we're pleased to see happening around the country. When I look at all that you're doing and all that you've done, you just wonder how in the world you maintain the energy that you have and the focus that you have. And you keep from getting burned out. So what's the secret for you?
There is no secret. Um,
Okay.
I will say I'm still a physician, and it's a specialty in which, for me, every day I wake up and I thank God for the ability to serve my purpose and to serve what He's put me here on this earth for. And it's one of those things in which, even through my burnout, I see my mission, and that actually is what drives me. I will not, let me back up and say I don't feel like I've burnt out yet. However, it is something that's difficult to balance. I'm not going to sit here and say I had the answer to balancing the lifestyle of being a physician, a mom. It's not easy, but it's definitely something that my mission is what drives me. Looking at my kids, that drives me. Seeing my community, whether it be we have a long ways to go, or seeing some of the small steps in improvement is what drives me. So I think
Wonderful.
that's been my fuel.
Earlier on, you mentioned the challenge of getting medical students to want to choose nephrology, but a larger issue might be, how do we get young people from underrepresented communities to be interested in healthcare in the first place? You have some thoughts about that?
I will say I do some career fairs here with middle school and high schoolers, and very few, will come to the table and say they want to be a physician. And when I ask, never shunning why, they don't consider it, but just when I ask, I think the most common thing that they think is, I can't afford it.
Mm.
And I always encourage them to know that, there are ways in which you can get through to medical school. I know there are grants that got me through Meharry. There are scholarships that got me through Meharry, in addition to loans. And then we have the programs. I think that's TSU has
Yes.
a partnership program, and
Mhm.
I'm not sure about, there's another program around the time when I was there, if they're still in existence, but there are a variety of ways in which, I think, and I can't personally speak to it, but the most common thing I hear is, I can't afford med school. And then obviously there's med school is hard, but, definitely encouraging them to see the long road of it and not just the, immediate gratification of sports or entertainment. Cause that's kind of what I'm up against whenever they come, to my table to chat about careers. It's majority of them in these minority schools are interested in sports and entertainment. And again, it's, well, I can't afford medical school, or it's hard. So it's just a matter of encouraging them to know that it doesn't have to be hard, encouraging them in their math and sciences at a younger age, and then knowing that there are opportunities out there.
But I would imagine that you're a great role model for the students who are asking that question. So I'm sure that you're going to result in a number of young people choosing to become a physician. So thank you. Thank you for that.
I hope so.
I think so. I'd like to close the conversation by giving you a chance to have a call to action. Is there's something that you'd like to leave with future Meharry graduates or young people who are thinking about the medical profession? Any words of wisdom or inspiration for them?
Definitely for the Meharry graduates, I would say, keep in mind your purpose. If you haven't found your purpose yet, it doesn't mean you can't and you won't, but just continue to search for your purpose and find your purpose, and know, because here it is, between geriatrics and nephrology, and my purpose found me. It was the understanding of, here's this young lady who looks just like me, but now she's lost a full ride softball scholarship because she has kidney disease out of nowhere. And so that just kind of made me say, wow, maybe there's a place for me there. So just always remember your purpose. I think that'll keep you going. Definitely have a purpose, because when things get rough, when you question and you doubt, you can always look over at that purpose and say, this is why I'm doing it, whether it be for your family, whether it be for your kids, whether it be for your community, or just for your love of Christ. Just definitely find your purpose. And then for those who are not in med school, definitely, find someone you look up to or challenge the norm. You don't always have to do the most popular thing,
Yes.
always want to stand out.
Yes. Well, thank you so much for joining me today. This has been a wonderful conversation, and I'm sure you're going to be an inspiration to a lot of young people. So thank you for that as well.
Thank you, Dr. Hildreth, for your ongoing leadership and all that you've done for our college. Since I graduated in 2012, the university has definitely expanded and grown. I brag about it from many, many miles away.
Thank you so much. I appreciate that.
Thank you.
Today's myth: you can't provide high-quality kidney care to underserved communities without a traditional brick-and-mortar clinic. The truth? Telehealth is changing that. Dr. Sharica Brookins' practice, Remote Renal Care, brings expert kidney care straight to patients in both rural and urban areas. Here's the proof. A study in the Clinical Kidney Journal found missed appointments dropped from 53% to 29%, and attendance rose from 61% to 72% with telenephrology. Another study in Kidney 360 showed over 95% patient satisfaction for virtual visits. Telehealth is showing that high-quality, accessible kidney care is possible, especially for patients who face barriers to traditional clinics. Thanks for listening to Public Service Announcement. To follow along on the rest of our journey, visit mmc.edu. And please remember to follow, rate, and review this show wherever you get your podcasts.